Hi, my name is Daniel, and I'm a public health nurse working for Humboldt County's Communicable Disease Department. We are currently dealing with the Shigella outbreak that's happening over in the greater waterfront area. And we have found that there are 5 confirmed cases, and there are 11 other additional cases that we are investigating. Shigella is a gastrointestinal bacteria, which is really just a fancy way of saying that it causes diarrhea, upset stomachs, gas, that kind of stuff. And typically, this bacteria is found within a person's feces or stool. And even though that's where it's typically found, you could still spread it, if you make contact with different surfaces and it's not clean and disinfected. And typical symptoms of Shigella may have, diarrhea that could or may not have blood. Usually people have really upset stomachs, bloating, cramping, that kind of thing. A fever may also appear, and that's something to be on the lookout for. And some of the ways that you can kind of help yourself is making sure to have good hand hygiene. There is nothing better to prevent Shigella than good hand hygiene. So I just want to also mention that Shigella is a fecal-oral type of bacteria, which means that it is only transmitted through contact and ingesting the bacteria. That means you do not have to worry about it being transmitted through the air, like if someone sneezed on you or any of that. This is really a surface problem and a hand washing thing, which is why we are heavily emphasizing that everybody, have really good hand hygiene. And if you have doorknobs or anything that has a high traffic where lots of people are using it, then to disinfect regularly with bleach or high content of alcohol solution. And one of the other things right now, because we are experiencing, a pandemic with COVID, we know that COVID can sometimes cause diarrhea, which may mask Shigella. We have had cases where it came into our radar because they were hospitalized for diarrheal symptoms, tested positive for COVID. However, then it turns out that they also had Shigella. And this is the reason why it's really important to be on the lookout for that. One of the other things that you can pay attention to is just how the diarrhea is affecting the family. If it's only 1 or 2 people, you should still get tested. However, if you are seeing the entire family being affected by diarrhea, it's a very stronger likelihood that it is Shigella and not COVID. Shigella is also one of those types of illnesses where often there's not a lot of complications. In some folks it can. However, for most individuals with healthy immune systems, it will clear out on its own. However, the big thing about that is even if it clears out on its own, Shigella can still be shed in the stool for sometimes weeks after, like up to even 6. And so one of the things that can help in terms of stopping it sooner is to go ahead and get treated for it with antibiotics. That will make sure that it dies off faster and that it will no longer be in your stool to transmit. The other thing about Shigella is that not everybody has to experience symptoms. There are some folks that will have minor symptoms or almost no symptoms, and in those cases, they can still transmit it. Shigella can infect somebody with as little as 10 microorganisms, meaning this is a very highly contagious thing. And certain things that we may not think about, like maybe if we're handling trash or changing diapers, that's something that's very common to us to think about. But other places that, surfaces that you may not think about could be like produce, or if you go to a gas station, you touch an infected handle. This is the reason why we are suggesting that everybody washes their hands before putting anything in their mouth. And that can include food, before handling food, after handling food, and then of course, always washing hands after using the restroom. Hand sanitizers should have at least 60% alcohol, and if you have less than that, it will not kill Shigella. But it still is not as effective as hand washing, just because sometimes you might have very soiled hands. But in the absence of water and soap, hand sanitizer is better than nothing. If you are experiencing any symptoms of Shigella, such as diarrhea, then you should contact your local primary care provider. And if you do not have a local primary care provider, then please contact public health.